Hello, I am Dr. Rhys Evans. I'm an associate professor of rural development at the Hogeschool for Groenutvikling in Bryne, Norway. This is a report on the development and the present day status of care farming in Norway for the new Nordic Nature-Based Services Model project. It provides background and understanding of how the sector arose and developed in Norway, and provides something of a snapshot of how the sector is currently doing. It includes a PACO analysis of the sector so that others can learn from its strengths and weaknesses. So the story so far. Relatively a lot has been written about the establishment of the green care services sector in Norway, as it was developed relatively early and has had considerable initial success. Initially, the impetus to develop green care services was a result of a combination of a cadre of potential service providers, often retiring teachers, social workers, care therapists, in cooperation with existing farmers, combined with a desire to create an alternative rural employment on the part of the government. So from the very beginning, care farming has been seen as a way to increase rural employment through farm multifunctionality. And as a result of the policy intention to increase farm multifunctionality, development funds were made available through Innovation Norge and other programs to support the conversion of small farmsteads for green care services provision. These policies were implemented in the mid-2000s, with the result that the agricultural census of 2010 indicated up to 1,100 care farms were operating in Norway. Now, this number has declined, partly as a result of retirements, to approximately 450 to 500 care farms in 2020, although there are also data issues around that number. Currently, however, the sector remains very active, and care farming, or grønnomsorg, is an important farm multifunctional activity and is supported by most actors within the farming agriculture sector in Norway. And the sector focuses primarily on three types of activities. First, education and pedagogics, from kindergartens through to forest classes. Two, for the provision of work to those at risk of unemployment through handicap or lifestyle challenges. And three, the delivery of quality of life enhancement for those in care, including those in permanent care due to physical or mental handicap, and increasingly to the elderly and those with dementia. Now, more generally in Norway, we have a governance structure that's tripartite, and you have the national level passes legislation, the county level implements legislation, and the municipality manages and pays for delivery. And this applies to green care services, with the addition of the National Unemployment and Welfare Agency called NAV, which also operates at the municipal level to buy services. So we have this three-tier system. Before we go on, we need to clarify the terminology I'm going to use. And basically we have three actor groups in here. The first is the clients or service users, then we have service buyers, and then service providers. So the service users are those who receive the benefits through taking part in activities on farms. The service buyers are those who purchase and pay for services delivered to the clients. And the service providers are those who deliver the services. They may be farmers or partners with farmers with specific professional qualifications relative to the client group. And generally, although there are variations, services are provided in a partnership between a farmer and a professional therapist under contract to the municipality. The type of farms used range across a wide set of types, from horse farms through horticultural production, market gardening, mixed farming, animal production. Generally, though, care farming takes place on relatively small farms and not on the most production-focused industrial farms, that practice industrial agriculture. Now, when we talk about the sector, its structure, we have to highlight that the regulation and participation in the Norsk Grønnomsorg sector is complicated, it's complex. And we are only talking about farm-based green care services. Other green services like outdoor recreation, etc., are structured separately in Norway, often under tourism services or riding services, which have their own sets of regulatory actors. But even within green care, there are multiple actors. You know, again, we've got the three types: the service users, the service buyers, the service providers, and then we have a set of policy implementers, including the national parliament and the counties, but more as well. A 2009 report from Rogaland County identifies 4 categories, and they talk about the users, the providers, the buyers, and then the group that provides approvals, which is what I'm calling regulators. The first of the regulators is called Matmerk, which is actually a non-governmental organization or a quasi-governmental organization, which manages the national quality standards for agriculture. And in particular, it focuses on the adaptation and quality of premises, as well as animal welfare and food quality. And Matmerk, from 2014, Matmerk awards Inputuna status to the farms that having fulfilled its quality standards. And I'll come back to Inputuna. There are also academic and professional authorities who certify social workers or give equine assisted therapy qualifications. And they're also a part of the sector. And then there are the trade associations, sorry, which include the farming unions, the 2 farming unions, both the big farming union and the small farming union, who both have green care service policies now. And then, of course, you have Inputuna. Now, Inputuna is a trademark that has been empowered by national legislation to be both the trademark and the association of providers of green care services on farms. Inputuna, by the way, means in the farmyard, but it also secondarily sort of is like welcome to the farm, and it has that implication when it's used. So Inputuna is organized as regional member associations, approximately conforming to the county boundaries, but not always. And membership is not mandatory. And we'll come to this when we look at numbers, but it is becoming more and more effectively so that Inputuna is the national legal format for delivering care farming in Norway. And then there are, within the sector, some intermediaries. There are what we call brokers. And in this case, they are small private businesses who connect service providers with service buyers, and who manage the contract details, etc., for a small percentage fee. And these brokers are particularly active in linking NAV, again, the social welfare organization, with service providers. And so they will be, NAV will say, we need to place this many people, and the brokers will find the farmers who have the places to do that, and then we'll manage that contract between them. Now, not all providers use the services not only on this page, but from before. Some will just contract directly with the communa, but of course it does require considerable effort, both at startup and ongoing. So increasingly you see this, and I have to say all Norwegian farmers pretty much use a specialist broker to manage their paperwork for subsidies, for tax. So this is something that they're quite familiar with and quite comfortable with. Again, other actors, well, the farmers' unions, that's Bondelaget, Småbrukslaget, who insist that the providers must be a farmer within their definition of farming. So they keep Inputuna within the farm. And also there is a new association of member associations called Inputuna Norge. It's only a small number of years old at this point, and they have relatively small coverage. 5 of the, I think, 13 Inputuna associations are members, but they are working to deliver a single voice at a national level and to support the efforts of both regional and Putuna associations and individual service providers. And we also cannot forget Innovation Norge, which was involved in creating the initial legislation which founded In Putuna as a means for delivering care farming, and which provides startup grants for new entrants and innovation. And then, of course, there are even more actors. There's the National Association of Members delivering, the specific therapies, which we mentioned. There's the universities and colleges, which deliver training and professional qualifications. And there are regional health trusts responsible for the hospitals and for acute care. And in a few cases, they are also responsible for chronic care, or at least a portion of it. And this is an important thing. You have to understand how the healthcare sector within Norway works to understand where green care services work. Generally, healthcare provision is divided between these regional health trusts who run the hospitals and give acute care, and then the municipalities who are responsible for primary and long-term care. There are exceptions to this, however, particularly within the health trusts, where some individuals have started, for example, special facilities for post-operative therapy using horses. But generally, you have this strong separation between the acute care sector and the primary and long-term care sector. And so, of course, this means that green care services fit within that long-term care, and therefore mostly are found, are expressed within a municipal level scene. Here we have a diagram. That's as simple as I could make it. You can see all of the different actors that I've mentioned up to here, and some of the reciprocal and some of the non-reciprocal relations, and the really strong ones. It is important that we recognize that the service user is actually very important here, and that this is a system that is built around them, ironically at the center, even though on my diagram they're out here, on one side, but everything is focused towards supporting them. So providers face a complicated challenge in getting established. First, they must prove their competence. They've got to acquire academic and professional qualifications. They have to adapt the farm and its built environment to purpose, and have to gain MAT/MERC approval for those adaptations. They have to plan and create a program of service delivery, and they have to acquire capital to invest in all of the above processes, and then they can go looking for contracts with their local service buyers. A complex system. Now, to talk about numbers, as I mentioned before, in 2010, the Norwegian Ministry of Food and Agriculture, Local Government and Regional Development ran its agricultural census and came up with 1,100 farms. In 2019, MAT/MERC announced they were 450 farms, but also announced a set of increases, which would take us, I think, in 2020 up to pretty close to 500 farms that are approved, MAT/MERC approved In Putuna care farms. Now, you have to ask why. Why are we at half the number in 2020 that we were in 2010? Well, partly as a result of retirements, as the first cohort of care farming providers retire. I mean, remember, many of them retired from being teachers or social workers to start their green care operation. But also, it's partly due to the challenges of entering a complex system with complex regulation. Ease of entry is not so simple, or entry is not so simple. As the system has become more mature and it's more regulated and more bureaucratic. And thirdly, being more regulated and more bureaucratic means that what we count as care farms are those that fall within the regulations and the bureaucracy. So perhaps we don't count them all the same way they did in 2010. But nevertheless, 500 care farms operating in Norway is a good foundation, a good base for a healthy system that is still growing. Now, when I come coming back to the difficulty of entry, you don't need to read all of this. This is just taken from Matt Merck's, one of their brochures to how do you start an Inputuna. And you can see it's a very complicated, time-consuming system that involves audits. And if you fail, you have to redo it. It's complicated, and you've borrowed money to do all of this to your farm, and you still aren't earning an income. And this is what I mean by barriers to entry. You know, you've got to have a lot of passion. There's got to be a lot of care, and you've got to have a way of making a living while all of this goes on, you know? So the system does have some challenges, and this is from a 2012 report. You know, there are some, and the challenges with accepting private businesses within the Norwegian healthcare system, particularly the health trusts, you know, non-professional, none of us. And there is therefore a bit of a siloization going on. There isn't a lack of appropriate research and documentation about measures of success, which makes it very difficult for those who work in evidence-based medicine to accept these kind of services. There is an increase, you know, an ever-present need to clarify and document public benefit. Is this cost effective? Does it provide better outcomes for service users? There is a need to set priorities with and within the healthcare sector to include grønnomsorg, and a need to improve dialogue across all the actors in the system. And finally, finally, there is a need to create longer-term contracts for the providers, because most providers only have a one-year contract with a municipality, and they have to go through a renewal or negotiation process every year. Now, this was said in 2012, and these challenges all do remain still in 2019, despite some progress. This same report listed these areas for future development. And I think we can say that we need it here in Norway like we need it in all of the countries across Europe that want to develop a green care sector. Increased and targeted knowledge, especially in research. There needs to be a greater emphasis on competency development and training. For example, I was just part of a social farming in higher education project that finished, which created a bachelor degree for universities to use to teach care farmers. And whilst one half of that was on social work, the other half was within agriculture departments. And I think that's what here in Norway we need more of still. How to be an actor in multifunctional agriculture. We need communication, better communication, especially around these quality assurance systems, more dialogue, more coordination, particularly at the municipal level. A lot of municipalities operate on their own, directly contracting with a provider, and there's no municipal over-organization where they can share best practice, well, etc. Yes. One new innovation, however, is this Inputuna Norge SA, and it's in this national organization made up of members of the regional Inputuna associations, because they are trying to form a practical organization that deals with issues important to the practitioners. And they're consciously trying to take a prominent role in publicizing, advocating, and giving input to national standards at a national level, because the Inputuna organizations operate at a regional level. And in conversation with them, they're saying that they are also beginning to look at discharging this broker function on behalf of their members. Now, Inputuna Norge, its key partners include, I mean, this is very good, the Farmers Union, the Small Farmers Union, Matt Merck, the Norsk Landbruksrådgivning, the Farm Advice Outreach and Assistant Organization, Gjensidige, which is the cooperative insurance provider, which will provide tailored packages for green care, and Samvirkesenteret, which is the community development center, which operates at a national level. So they have great other partners, and I think we're going to see a lot more of them than that. And I think this is an important innovation in the sector in Norway that's responded directly to the challenges of the sector. So The last part of this presentation is a PACO analysis of the sector. Now, we use this PACO analysis rather than a SWOT analysis, which you will be much more familiar with. And that's because we believe it's a bit more accurate, and most importantly, it ends on a positive note because it's problems, and it starts with problems and it ends with opportunities, which is, we think, the right order to consider these things. It's something that was developed for the community development sector in Scotland, and I've been using it for the last 15 years, and for the last 5 years or so, it's becoming more widely accepted. You can see here, problems, advantages, challenges, opportunities. So the same process as a SWOT analysis, but with these focuses and in this order. So for the green care services sector in Norway, the problems, the first is barriers to entry, which include this complicated approval procedure. We're requiring certification for multiple actors and requiring significant investment before contracts can be signed. This is something to think about if you're starting or developing the green care sector in your country. Is this something that you want to avoid or that you can handle? Yeah? The diverse nature of the registration process means that there are no single actors covering the whole scene. And only recently has this new member organization that represents the concern of the whole sector been formed. So you don't have a national voice for green care services in Norway, despite the presence of approximately 500 farms. Another problem is that it's a complex field with multiple actors who access multiple budgets. They may be healthcare, they may be social care, they may be long-term care, it may be elder care, it may be even agriculture departments, supporting multifunctional agriculture. And the danger with this, of course, is you wind up with this siloization. I have my budget and I do not want to dilute it by giving it to you. Bringing those people together, and in fact, there was an attempt to do this in 2016, which was really not ultimately successful, in an attempt to bring the health trusts and the long-term care, local care groups together. And in the end, it foundered on the various parties not wanting to dilute their own budgets. And that's partly because there is some distance between the formal health trusts and the green care service providers, or the municipal providers at that level. Although Infotuna is nationally recognized as the vehicle for green care and other nature-based services, its regional nature means that if a provider can gain a contract to deliver services to a municipality without membership, without participating in Infotuna, that's allowed. If the municipality is happy to sign a contract with them, that is. So it actually makes it hard to discover at a national level how much service is actually being delivered. The sector has a number of good advantages, though. There is a fairly long history of provision of green services in Norway, and there's a good foundation there. And the certification process, although complex, does guarantee well-adapted farm spaces which are safe. And the complexities of the structure support delivery of appropriate local services. It may be complex, but within that complexity, there's this opportunity to respond to local demand and local provision. Also within the sector, the movement between the professional spheres, such as teaching, physiotherapy, etc., and the green care sector is not uncommon, which brings latest practice into the field. And it's facilitated by, again, the individual nature of each contract between the service provider and the service buyer. And also, an important advantage for the sector is the general acceptance in Norse society of the value and benefit of outdoor activity is beneficial for the sector and its potential growth. And there is innovation within this well-established sector. The recent creation of Infotuna Norge is one example, the rise of brokers is another, and more recently, the growth in new activities such as services for elders with dementia, which is the fastest growing subsector of the field. And you can find, for example, the regional Impatuna organizations will give courses on how to get into, how to support elders with dementia on the farm, and welcoming service buyers and service users to that provision of those services. Now, the sector does face some challenges. First of all, the pioneer cohort from the 2000s is nearing retirement or even already retired, and barriers to entry can limit new uptake, as we've said. And the complex set of regulations and actors require providers to be experts in field outside of either giving social care or farming. Like they need to be experts in bureaucratic reporting, as it were. And a number of interviews have indicated people somewhat frustrated with this. And this is one of the reasons also why these brokers are becoming welcomed, because they have that expertise. And the lack of long-term contracts puts off some potential entries and creates stress for existing service providers. It's hard to, you don't borrow money over a year, it's over 5 years on a commercial loan, and yet you've only got a 1-year contract. This can be quite a challenge, The regional diversity, while it's good at the local level, does limit the ability of this community of actors to act collectively at the national level. And so that's a challenge. And one of the first things I observed when I came to Norway 11 years ago and started looking at this is that the regional diversity results in access to green care services being something of a postcode lottery. You really are dependent on both passionate providers and passionate buyers. And so what you get is provision which is fairly uneven geographically. And as we have learned, overlapping jurisdictions or siloization, particularly around social care and health, create competition between these sectors and can interfere with provision to both an individual service user and at the level of service providers. Now, that said, there are lots of opportunities here. Demand is increasing, and further growth will counter this postcode lottery status nationally. There are increasing opportunities to learn how to do this as teaching is developed in the supplementary healthcare fields, such as physiotherapy and equine-assisted therapy, and also even within the Impatuna organizations, there are short courses for business development, those kind of things to help the green care service providers professionalize their own services. So there is increasing support, at an educational level for this. And in fact, recently, just this year, has been announced a new Impatuna Løfte 2, which is a new tranche of development funds given to the county governments this time to stimulate new provision, especially in terms of opening up new subsectors such as surveys and dementia. And so this is actually going to, we think, help stimulate the municipalities and new service providers to move into these fields. The creation of Impatuna Norge is going to expose the sector and its issues to national attention, and indeed it has already. The growth of these brokers is an opportunity because they can handle the things that, as I said before, that the farmers don't have an expertise in, and this allows them to concentrate on their own expertise. Increasing research is beginning to develop better evidence-based results, making the field more attractive, both to participate in, but also to prescribe, more attracted to the professional acute care sector. And Norwegian health policies devolving responsibility to local levels and placing new emphasis on well-being rather than illness have been tried. And as I said, they weren't that successful, but they do represent an acknowledgement that this is important. And I think we will continue to see more of this as time passes. And as we do, it can only be an opportunity for the green care sector. And indeed, there are these new fields of care emerging, and this creates new opportunities for providers. And indeed, some of my students in equine assisted therapy have actually opened farms caring for the elder with dementia. We can see already the growth in it. So in summary, the Norwegian sector has a strong history of development and a sense of identity. The complex way the system is organized optimizes diversity of service provision, especially in response to both local needs and local providers. And that same complexity can create problems in terms of ease of entry. And we have to see both sides of that. New initiatives should ease entry into the field and offer more provision to service users. And finally, a strong presence in education, social care, and health and well-being mean that the sector has strong foundations. Continued passion not only keeps providers active, but keeps them innovating new services. At the same time, national attention means that in general, nature-based services are well thought of, and this positive reputation will support further development in the field. Thank you very much.